A new study is warning that the number of men diagnosed with prostate cancer is projected to double by 2040 to 2.9 million a year. Annual deaths are also predicted to rise by 85%. CTV's medical expert, Dr. Shapiro, joins me now with more on this. And Doctor, thank you as always for joining us. These numbers are staggering.
Yeah, it's a shocking headline, but I want to point out that we're talking about trends in the world. So what we're expecting not only in high-income countries such as our own, but in low and middle-income countries. So if we look at the global numbers overall, this is the most common cancer in 112 countries in men. And right now, it accounts for about 15% of cancers. But if you look at what the study is predicting in terms of what will happen between now and 2040, what we're seeing is that, as you said, annually more than double from 1.4 million in 2020 to almost 3 million by 2040. The reason for that really is because of changing age structures and improving life expectancy drivers. So people are living longer. And the sad thing here is that typically it cannot be prevented by lifestyle changes or public health interventions. And sort of late diagnosis is widespread in a few sort of lower and middle income countries. We don't see it being diagnosed as late spread in higher income countries because of the way that we approach it. So, globally, as in lower and middle income countries, people live longer and have more chronic diseases. This will be one of them.
All right, let's talk a little bit about Canada. What are the numbers here?
So if you look at the numbers in Canada, they actually are more startling in terms of the 15% that you see globally. And that has to do with the fact that we are a high-income country. So annually in 2023, we're looking at about almost 26,000 Canadian men diagnosed, representing 21% of all new cancers compared to that 15% I quoted you globally. Almost 5,000 men will die, and that represents about 10% of the cancer deaths seen in 2023. So on an annual basis, and now bringing it down to a daily basis, about 71 Canadian men are diagnosed every day, and about 13 Canadian men die daily. So it's almost as if we are at that point that we're being given global warning, and that has to do with the fact that we are a higher income country that already is doing not universal and not necessarily equitable screening, but we are doing quite a bit of screening.
Are those numbers, the way they're growing, is it because we are getting tested? Men are actually coming to the doctor and getting checked?
So it has to do with a combination of both, that we are aging more, so we are seeing more men in their 5th, 6th, 7th, 8th, 9th decade, and we are screening these men more, getting the message out that it's important to think about doing a PSA, which is the blood test that we do, but not a PSA alone, a PSA along with a rectal exam, which a lot of men shy away from. In Canada, we talk about the 5th decade unless there's strong history that would make you think earlier. In the States, they look about the mid-4th decade for starting to do this kind of screening.
But it is worth doing it because this is one of the most treatable cancers when caught early, though.
Absolutely. And if you look at risk factors, unfortunately, most of them are not modifiable. So advancing age, family history, more in Black ethnicity. Interestingly enough, obesity and tall adult height has been associated. There are some inherited gene mutations. And then, of course, tobacco and pesticides, those are the ones that you can avoid. But it's that really advancing age in terms of that tsunami advancing age. And along with it comes a higher risk of prostate cancer. So it really is, looking globally what we can do and really looking towards things like AI, more advanced technologies, not necessarily calling for more urologists to do screening, but better and more equitable ways worldwide for us to do this because we don't want to pick this up as a late diagnosis.